Here at the Academy, I had a privilege to talk about some novel imaging techniques that we use both in the clinic and in the operating room, as well some of the new techniques of how we actually operate. So in particular, I focused on OCT angiography and how useful it can be in clinic when you have a patient that might present with more of a complex presentation, and when you need to see if there is a choroidal neovascular membrane. I find that particularly helpful in those cases. I also talked about using intraoperative OCT and cases where I find it benefit the patients and improve patient care. For example, I showed a patient where there was a small macular hole that was discovered in a retinal detachment because we did intraop OCT that was not appreciated on preoperative imaging. And also I talked about using 3D visualization where you can have improved ergonomics, improved teaching, as well as pretty outstanding view of the macula for macular work. So I focused on that, and I also introduced the idea of gene therapy and how we can utilize all these modalities for patients that might need gene therapy. There has been big strides in gene therapy world, and there's a lot of ongoing trials that hopefully will have some exciting results that could benefit our patients. And I think it's a very good point, right? I haven't been in practice for that long, and the way I take care of patients has changed in the span of 5 years. And I think it's very exciting to be practicing at a time where we do have these new modalities, and we're studying and providing evidence-based reasons why these modalities are important. So whether they allow us to diagnose the patient better, or whether they change the treatment course. And I think all of the modalities that I mentioned, OCTA, intraop OCT, really do benefit patient care. And also we want to teach the new generations, and I think 3D viewing is very helpful in that, because when I'm operating in the OR and I use 3D viewing, not only the trainees, but also my whole staff, including the scrub tech and even anesthesiologists sometimes, can participate in the experience. And the scrub tech can then anticipate what I need next because she can see the surgery, she's immersed in it. So I think it's really the advancements that are happening, and being here at Academy, I mean, there's so much exciting stuff happening. It really takes our patient care to the next level.